Hello everyone, my presentation is on a basketball player and its injury is a slap tear. About the player, Dwight Howard plays center and power forward for the Los Angeles Lakers. He tore the labrum in his right shoulder back in 2013 in a loss to the Clippers, sitting out 6 games, dealing with soreness related to the tear. He decided surgery was a no-go since he would be sitting out 6 months if he got the surgery. Since Howard's mentality was to play through the pain, he found himself re-injuring his shoulder midway through the fourth quarter against the Memphis Grizzlies and re-aggravating it 2 days later. The word SLAP is actually an acronym, which stands for Superior Labrum Anterior and Posterior. A SLAP tear affects the labrum, which is the cartilage on the rim of the shoulder socket like rubber, holding the ball of the shoulder joint in place. Now, how may it occur? The tear occurs in the superior area of the labrum, which the bicep tendon is attached. Specifically, the tear happens anteriorly and posteriorly of the attachment. The bicep tendon might even be injured as well. There are 3 main causes of the slap tears: chronic injury, acute injury, and aging, where chronic injury happens over time who play sports. It is also the most common cause, where there are repetitive movements, especially with the arm above the head, such as throwing actions, racket sports, and swimming. Even repetitive heavy lifting, which pulls down on the arm, like weight uh, weightlifting. Acute injury happens when one blocks a fall with their arm reached out or uses obstruct jerking movements to lift heavy objects. Aging happens when the labrum wears out over time, seen in people of ages 40 and older. If the injury is not severe, it might heal with non-surgical treatments like ice and physical therapy. Otherwise, surgery is needed if the tear is serious. There are also a wide range of signs and symptoms, like shoulder popping, locking, or grinding, pain with certain movements or positions, pain when lifting things overhead, reduced range of motion, shoulder weakness, pain in the front of the shoulder if the bicep tendon is also injured. There are also special tests that can determine this: bicep tendon test, the Clunk test, the compression rotation test, and the O'Brien test, as well as imaging tests. The MRI, CT scans, and X-ray are a few. For a better picture, let's imagine a golf ball sitting on a tee. The ball represents the head of the humerus, and the tee represents the shallow shoulder socket made up by the gleno, a part of the scapula, the shoulder blade. As many golfers know, a golf ball is very easily knocked from a tee, which in this analogy would represent a shoulder dislocation. The labrum is essentially an extra ring of tissue around the tee, resembling a washer. It protects against dislocations by extending the surface area of the tee up and slightly around the ball, thus making it much harder to knock the ball, in this case, the humerus. There are 4 types of slap tears. The first shows degeneration, where the edges of the labrum fray but stay attached to the glenoid rim. The biceps tendon is unaffected. Type 2, the superior part of the labrum and the bicep tendon are torn off the glenoid rim. Type 3 has a bucket handle tear of the labrum, where part of the rim detached, forming a flab which can get caught in the joint, causing locking or catching sensations. Type 4 as well has a bucket handle tear of the superior glenoid which extends into the bicep tendon. Here we see another image of the 4 slap tears. In our case with Howard, he did not need surgery. But let's say our patient needed surgery. What would that look like? In this timeline, it will show the after surgery. Week 0 to 4, patients wearing a sling day and night. Week 5 to 6, gradually improving range of motion, PNF, light manual resistance. Week 7 to 12, progressing range of motion, isotonic strengthening for 7 to 9 weeks. 10 to 12 weeks, slightly more aggressive strengthening. Week 13 to 20, stabilizing and maintaining full range of motion, improving muscular strength, power, and endurance. Months 6 to 9, full recovery, player is able to return to play. Phase 1. There is no exercise. Our goal here is focusing on diminishing the pain and swelling, promoting limited joint motion to prevent the negative effects of immobilization while protecting the repair. The torn labrum is healing to the bone in its proper position, so rest, ice, cryotherapy, and modalities are the way to go. Our goal in phase 2 focuses on restoring full range of motion, preserve the integrity of the repair, restore muscular strength and balance, and a few exercises for these would be side shoulder stretch and wall stretches, wand assists and shoulder flexion. Isometric exercises would be shoulder external rotation and internal rotation. In phase 3, we focus on establishing and maintaining full range of motion still, improving muscular strength, power, agility, and endurance, as well as gradually incorporating functional activities. Exercise like strengthening 90-90 position, arithmetic stabilization, tubing, ABCs, figure eights, body blades, and PNF D1 and D2. In phase 4, our goal is to focus on enhancing muscular strength, power, agility, and endurance, progressing functional activities, maintaining shoulder mobility, incorporating a gradual return to play sport activity as well. Exercises like push-ups, medicine ball overhead toss, medicine ball balance, plank, shoulder taps, one-hand push-up elevation. Our goal here in our total patient incorporates return to sport activities, maintaining full strength, mobility, and stability of the shoulder, exercises that include kettlebell overhead squat press, mountain climbers, planks with Swiss balls, burpees, cardio like karaoke, jumping jacks, butt kicks, cycling, etc., lateral jump, side pulls, to name a few.